For any new mother, labor and delivery is first a pain and then a joy. But the life-changing process can be a life-threatening experience.
Take a deep
A
breath.
virtual nightmare.
You're not believing me. Oh!
For those mothers in the high-risk unit, anxiously awaiting their own special deliveries.
A girl or a boy?
Because they're about to arrive any day now. In California's fertile Central Valley, high-risk mothers-to-be come here, to the Community Medical Center in Fresno. Mothers like 20-year-old Raquel Maldonado.
Let's see if we can track down this baby.
Raquel is no ordinary high-risk mother. She's an epileptic. And to control her seizures, Raquel has been on medication for most of her life. Unfortunately, it was the medication that caused a birth defect in her first son, Alejandro, now 2.5.
Say hi, Alejandro.
Hi.
Alejandro was born with radial aplasia, a deformity of his hands and arm bones.
He has 4 fingers on one hand, and on the other he has all 5, but the thumb doesn't, it's not connected.
Radial aplasia is rare, occurring in about 1 in 100,000 births. But women on anti-seizure medication, like Raquel, are more likely to have a baby with a birth defect.
And we try to stress to them that their risk of having malformations might be twice that of the general population.
But today, doctors are concerned about something else.
She's developing a condition known as preeclampsia, or high blood pressure during pregnancy.
Preeclampsia can lead to seizure or stroke, and in a woman prone to seizures, it can be deadly. The only cure? Deliver the baby.
Looking at the risk of keeping her pregnant as compared to the risk of letting her deliver, I think we're going to say that this baby's had plenty enough time to cook, and the risk of her having a seizure or a problem down the road, now if she stays pregnant, is too high to let it happen.
Oh,
Oh, you didn't want it that cold?
I don't want it all.
Doctors need to get Raquel into an active labor pattern, so they order Pitocin to induce her. But they also give her magnesium to keep her blood pressure down. Ironically, magnesium can also slow down contractions, but it's vital.
Worst case scenario is mom has a seizure or an event related to her preeclampsia that could lead to emergent fetal distress and the emergent need to intervene. And once that happens, the clock starts ticking.
With her family standing by, 19-year-old Angelica Granados is about to have her first baby.
I'm 37 weeks pregnant. I came in about 8 o'clock this morning because my water had broke.
By all accounts, with a young, healthy first-time mother and an almost full-term baby, this pregnancy should be fairly routine. But it's not.
My blood pressure's just been high today. They noticed I had protein in my urine yesterday. I was getting maybe a little bit headaches.
These are all signs of pregnancy-induced hypertension, another hurdle in a journey that for Angelica has been riddled with uncertainty. At 20 weeks, she underwent an alpha-fetoprotein screening. The results were devastating.
When I got my AFP screening test done, that the baby came out positive for Down syndrome.
But the AFP is usually supported by the more invasive amniocentesis, which can confirm or rule out Down syndrome. However, it's risky. Some women can miscarry. Angelica spent a week agonizing before deciding on the amnio.
I'm the type that needs to know for sure, because I don't want it to be on the back of my mind. So then I ended up getting amniocentesis done, and then just the time waiting for the results to come back was just stressful. But then the results came back and that was okay. It was okay, so that's when I found out I was gonna have a boy.
But things aren't all right yet. Today, Angelica's blood pressure peaked at 148/87.
High blood pressure is the silent killer and puts stress on the placenta. Also, the extra stress in her body is pulling protein from her kidneys. So her kidneys aren't taking that protein and putting it back into her system like it should. It's actually coming out in her urine, which is not normal.
And the results could be life-threatening.
She can go into renal failure, she can have liver damage, she can have seizures, etc. But usually when we diagnose this, everybody delivers. We never get that.
You become severe the longer you become pregnant and the longer you stay pregnant. And the only cure for this disease is delivery. Angelica, is that medicine working for you? Huh? Yeah? Okay, so you don't want anything else yet? Not yet, okay.
Angelica is only at 5 centimeters.
I'm monitoring Angelica's contractions. That way we know if they're 4 minutes apart or 6 minutes apart. The closer the...
No sixes. It's coming down, sis. It's almost there.
And her headaches are getting worse.
My lips are getting dry.
If she doesn't deliver soon, she could go into seizure.
I'm gonna check your cervix, sweetie, okay? Just breathe deep, okay? I'm sorry.
28-year-old Myrna Saravia is overdue.
Hi, can I get the oxygen on her, please?
She's 41 weeks pregnant with her first child, a baby that was due 8 days ago. She was admitted yesterday, and today her doctors started inducing labor. In the past 5 hours, she has dilated to 2 centimeters. But Myrna's not worried.
There's no chances for me to have a C-section. They said everything's fine, everything's normal, so I can have the baby normal.
However, there is something that is worrying her doctor.
Right now, the baby's heart rate gets a little bit low, and what we're gonna do here is I'm gonna see if, it looks like maybe the contractions are just lasting for a really long time, so baby just doesn't get a chance to have a little extra breath here and there. So we're gonna see if we can try to stop her contractions from going, so long, okay?
Nana, grab my hand here. Grab my hand, okay? What she's gonna do, she's just gonna help you out having the baby, like I told you.
Okay?
She's gonna break the water.
We would probably take her to C-section if the baby's heart just doesn't come up.
A post-term pregnancy carries a multitude of risks. An aging placenta begins to lose its efficiency after 40 weeks, and when blood flow to the baby is decreased, the chance of fetal death increases significantly.
Baby sounds okay. This could be a long process where things could definitely worsen. Just slipped right off, but as long as we can keep...
I'm going to go in, I'm going to check her blood pressure again.
Nurses at Fresno's Community Medical Center are concerned about Nicole Serta.
Okay, a little bit higher this time. Are you a little tense?
The 18-year-old mother-to-be has high blood pressure and is spilling protein in her urine.
She's like a 2+ on the scale right there. We'd like it to be negative or trace. So that's a fairly significant amount.
It means that Nicole's kidneys are being affected by her high blood pressure.
The only thing that we can do to stop it is to deliver the baby, which is what we're doing.
Nicole is also overdue. This morning, doctors started her on Pitocin to induce labor.
I'm nervous and scared. I'm kind of concerned about the baby's health a little. I think everything's gonna be okay.
But everything is not okay.
With protein in the urine, it's a sign that the kidneys are definitely being affected by the high blood pressure, that the vessels that supply the blood to the kidneys are being damaged to the point where the kidneys are not functioning properly.
Right now, Nicole has to get into a labor pattern. She's dilated to 4 centimeters. She's got a long way to go.
Sweetie, you're 9. Okay.
Oh my gosh.
See, baby? You're 9.
Mija.
You're doing a great job. Okay.
Angelica Granados and her boyfriend Ricardo Leon are minutes away from parenthood. Her mother has been charting her contractions all morning.
Oh, she's okay. She's in tremendous pain. She's my baby, and I'm just so excited. And it hurts me to see her like this, but I'm excited.
But with high blood pressure and protein in her urine, Angelica is in a serious danger zone. The only cure, deliver the baby fast.
At 3:30, she was 5. So, and it is 4:13, and she's complete. Can't get better than that, can it? No. We went to get her an epidural, and it was too late. She doesn't need one. We're gonna deliver before we could get her one.
Okay, Joyce, we're ready.
Push, 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 push. 2, 3, 4. There you go. 5, 6, 7, 8, 9, 10. Good. Come on, you can do it.
Roll hard.
Push, push hard, push hard, push hard. You can do it. Push right past that. Remember how I said you got to push past that? Push, 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 push. Good.
Take a breath, baby. Take a breath. Breathe, baby. Breathe, baby.
Come on. The next 1 to 2 pushes. I don't know, it looks like a girl's head. Is this a girl or a boy?
She wants a boy.
Oh,
Here he
excellent.
comes. Here he comes. Push hard. Push into it. There you go. There you go.
The baby's head comes out, but there's a problem.
There was a cord around the neck, which was tight. We couldn't reduce it over the head, so we had to clamp the cord and cut the cord.
Once the pressure from the tight cord is released, the baby is in a little bit of shock. He still hasn't made a sound. Angelica can only get a brief glimpse before the nursing staff takes over.
All right, let's get him roughed up a little bit so he starts to cry.
Nurses begin stimulating his body in order to get him to open up his lungs.
Said I just need a jump start. Just say I just need a jump start. He's cute.
Cute, he's a cute
said,
baby.
Hey, you guys, he's doing good. He's getting pink. He just needed a little help there. He just needed some oxygen.
After months of prenatal difficulties ranging from a Down syndrome scare to life-threatening preeclampsia, everything seems to be fine. But it's not yet.
Turn you around so I can see what you look like.
The magnesium that kept Angelica from having seizures has caused her baby to have delayed reactions.
How much you weigh? He's still a little pale. Just because the shockiness, and he's a little floppy too, and that's muscle tone. The mag sulfate is a muscle relaxant, and babies get relaxed just like moms do too. So his tone is good, but he is a little bit more relaxed than when he first came out, and that was to be expected from the mag.
Ricardo Rafael Leon Jr. is small for a 41-weeker. He weighs only 5 pounds, 3 ounces.
He's small because of the high blood pressure problem that Angelica has had, but with nutrition, proper feeding, he'll be big. He'll probably be a football player soon, or it could be a baseball player playing for the Red Sox.
But perhaps more important for this young mother, the amniocentesis she insisted on having 5 months ago was right.
This baby looks very healthy. I don't see any signs of Down syndrome. This baby should do fine.
He's a keeper.
We're still having a little bit of a hard time monitoring your contractions, and it still is really hard to trace, so it's very hard for me to see if you're in a pattern.
With her epidural in place, Myrna Saravia is feeling more comfortable, but she's still in danger.
She's got the preeclampsia, and we're basically monitoring her for that. She could head south, essentially, and her condition could worsen. Right now, the baby looks really pretty good, although that baby can change very quickly. They're pretty fragile, and they do really well. They bounce back really well, but it could go quickly downhill. I'll be back.
Because the baby's heart rate was dropping with each contraction, doctors backed off her Pitocin. But it's a catch-22. Keeping her pregnant keeps her in a preeclampsia state, which in a worst-case scenario can result in stroke and seizure for mom and death to the baby. 5 hours later, Myrna has progressed slightly, but now she's getting headaches.
Sometimes it's an indication that the preeclampsia could be worsening, even though her blood pressure isn't getting higher, even though she doesn't
appear to be having any more protein in her urine. Oh my gosh, I think you're about 4 centimeters here.
The next few contractions will determine whether Myrna's baby is strong enough to be delivered.
There we go, it's coming up, okay? You just had another run of really close contractions, okay? Maybe came down a little bit, but your contractions, they came really close again. So baby just kind of lost its power again, lost its breathing and stuff like that, got a little bit low. It's starting to come up though, okay? I'm gonna back off on this medicine, this Pitocin here a little bit, and just slow your contractions a little bit. Let's see what we got. Okay, because I wanna see the baby's heart rate getting a little bit higher, okay?
24-year-old Millisent Rodriguez is 38 weeks pregnant with her second child.
How are you feeling? Tired. Sleepy.
And today, Millisent is at Fresno's Community Medical Center for monitoring because her pregnancy is not normal.
Did you eat breakfast? No.
She's a diabetic.
You want a big glass of ice water or something to wake him up? Yeah, I can. No water, just ice. Just ice? Yeah. Okay. I can't give you juice because of the diabetes. Yeah, no juice. No juice.
Gestational diabetes occurs in 2 to 3% of all pregnant women. Millicent developed type 2 diabetes 8 weeks into her first pregnancy. She admits she didn't keep her blood sugar under control. At times, levels would reach 600. Normal is 90 to 130. The baby ended up with seriously low sugar levels and a heart murmur as a result.
The low sugar level really affected her because it's like taking a drug addict and taking them off really fast. They fiend for it. Well, she was fiending for my sugar, so she just plummeted in sugar.
This time around, Millicent has vowed to watch her sugar intake.
I learned to adjust with what not to eat and what I can eat and when I can and when I can't.
Millicent needs to control her blood sugar for 3 more days. That's when she's being induced.
Bye, Joyce.
Have a nice, healthy baby.
Thank you. Have a good weekend.
I'm going to check her again, see if we've made any cervical change. Some progress.
Since she started her induction, Nicole Serta has made little progress.
Kind of my back feels like it's burning, like in summer when you have the heater on or something.
At 9:30, she was 4 centimeters. Now, 8 hours later, she's barely progressed.
5 centimeters now. Really tired.
Because of her pregnancy-induced hypertension, doctors have given her magnesium sulfate to prevent seizures, but it also slows down contractions. So she's been given a special dose of Pitocin to get her into an active labor pattern.
We're still planning on a vaginal delivery, and hopefully with the Pitocin we can get the contractions a little bit stronger, a little bit closer, and kind of speed things along.
Seeing his girlfriend in such discomfort is taking its toll on Sonny Sheena.
Got me worried a little bit before when they were giving her that medicine to prevent seizure and stuff. That worried me a little bit.
Finally, Nicole reaches 6 centimeters, and that's where she stays. Doctors have to make a decision. The only cure for her hypertension is delivery, but she's barely halfway through her labor.
Maybe the baby is too big for you, or maybe the baby is not coming right. Time to deliver the baby by the other method. Time for a C-section. I think we have given her plenty of time, and she really seems to be stuck at 5 to 6 centimeters. Once we start,
There is no other choice. Nicole has to have an emergency C-section. It's been 6 hours since Raquel Maldonado was admitted to labor and delivery.
The next contractions could be a little bit stronger as the head comes down. The head's pretty well applied, so it's stuck down there pretty far. Not a whole bunch of water came gushing out. We'll see how you go.
With her water broken, Raquel begins to progress.
She's actually about 5 centimeters now, and she's really feeling what we call transitional labor. Her mood has changed.
Oh! Hurt.
The pain is secondary to Raquel. She's more concerned about this new baby and whether or not he will have the same birth defects as his older brother. Moments ago, Nicole Serta's doctors determined that her labor had stalled at 6 centimeters. They had to make a quick decision.
He'll be there in a little bit, Grandma.
They are going ahead with the C-section. After making the first incision and opening up the abdominal cavity, Nicole's doctor makes a second incision into the uterus itself.
Now going to make an incision in the lower uterine segment.
Within 45 seconds, he has the baby out and handed off to the pediatric team.
And here it comes. Osteopata has cut the cord. And on.
Jonathan Sheena is big,
8 pounds, 2 ounces.
but he's having some respiratory difficulty.
His lungs have a little bit of fluid in them, which is normal for a C-section baby. And as he cries, he'll take care of that. The fluid will move out of his lungs and into the blood vessels surrounding the lungs. So we try to keep him a little bit agitated, because the more he cries in here, the better he'll do.
I had tears in my eyes. I just heard him crying, and I just started crying myself, you know. And it was a very emotional moment for me.
Finally, Jonathan meets his mom.
Is she doing okay? Yeah, hey, little munchkin, the reason for all this excitement, huh?
And joins her on his first journey, out of the womb and into recovery.
Oh, it hurts.
Could you send a nurse, please?
Raquel Maldonado refused an epidural, and her pain medication is no longer working.
You do feel like pushing? I'm gonna kind of watch you through this next contraction.
Nurses are reluctant to check her cervix yet. Once her water is broken, she's prone to infection.
Oh, God.
Without the epidural, Raquel's body wants to do what comes naturally, push.
I have to. I'm telling you, you're not believing me.
Oh, I believe you. I do, but I just have to verify that.
Well, it's already gonna come out.
As soon as that pain's over, we're gonna check you out here. Let your legs come apart for me. Yes, the head's right there. I need the nurse in here, stat. I need Dr. Thomas, stat.
Nobody wants to believe me.
We're getting ready to have us a baby here.
Right now, every second seems like an eternity.
Wait, I gotta push. I have to.
We need Dr. Thomas, stat.
This is my new little son, Ricardo Rafael Leon Jr. About to get ready to go home, so getting all ready and packed up.
Despite the many hurdles during her pregnancy, Angelica's baby boy is just about perfect, except for one typical newborn condition.
Oh, they did a test on him because they said he had yellow jaundice. So we had to get the test done to see how his scores were, and his scores were good enough for him to go home.
In fact, his jaundice is so mild, doctors told Angelica she could treat it the old-fashioned way.
Keep him in sunlight for like 10 minutes every day, just to give him his color back.
Like all first-time moms, Angelica now has to plan her days and nights carefully, and she already knows what's first on her agenda.
What I'm gonna do when I get home? Rest. That's what I need to do, is rest. That's if I can.
After months of worry that maybe, just maybe, Angelica and Raphael's firstborn could end up with Down syndrome, this perfectly healthy baby is indeed a special delivery.
Dr. Thomas, please?
Yeah, where is he?
He's on his way right now.
Raquel Maldonado is about to give birth.
Great. You can do it. You can do it. Come on, come on. Push through the burn. Push through the burn.
Pull your legs back.
Right down here.
There you go.
You're doing great. You're doing perfect. There you go. Try not to scream and try not to breathe. Hold your breath and push.
And she's about to find out if the medicine she takes for epilepsy has caused any serious birth defects in this baby.
Good. Don't push. Just stop. Just relax. Okay? Just
I
relax.
can't stop. Hold on, hold on.
Hold on one second.
Hun, hold on, hold on.
Okay, perfect.
Oh, there we go. Baby's out. Good job.
He's a little unhappy. It's a little boy.
Boy, congratulations.
Baby came out vigorous, had a good cry. I always like it when they kind of try to grab the scissors from me and kick around a little bit versus being limp and kind of floppy.
But the baby does show signs of stress. Being born 5 weeks early is taking a toll on little David Anthony Rodriguez.
3 vessels. Congratulations.
Everything looks good right now, okay? I have to keep you on this medicine for about 24 hours, but I'll lower the dose so you don't feel so wiped out, okay?
Okay.
All right, any questions?
I want to see my baby.
No tears.
The magnesium is making Raquel too sleepy to care for the baby. Until the powerful medicine wears off, baby David will have to be taken care of by nurses in the nursery.
Babies have a hard time maintaining their heat, and to be wrapped up in a blanket at the bedside with a sedated or exhausted mother probably isn't the best place for a 35-and-a-half-week baby.
5 pounds, 6 ounces.
But before they take him away, Raquel has to see for herself if little David is healthy.
No, I'm happy.
10 fingers, 10 toes, and 4 bones in the lower arm, lower arm, so we're happy about that.
Baby.
Say David.
Happy.
The entire family is elated.
Oh, blessed Jesus, guide this little boy. Give him many, many years of life, Lord.
And Raquel finally succumbs to exhaustion. But while everything seems fine on the outside, baby David is still a preemie with preemie problems.
Baby.
Say David.
Happy.
Just breathe through it, sweetie.
Mitrail and Ernest Carter are expecting their 4th child.
All right, you're almost there.
And the baby is almost a week overdue.
She's at 9.
Everything was fine until 3 weeks ago, when Mitrail tested positive for group Strep B, a bacteria that can cause pneumonia or meningitis in a newborn. GBS needs to be treated with 2 doses of antibiotic.
Unfortunately, we were only able to give her 1 dose, but we'll just watch the baby for a couple days after that.
Were you dilated?
I'm going to break your bag of waters, so I don't think you're going to make it till your next dose of antibiotic anyway. She wasn't going to last the 4 hours necessary to get her 2nd dose, so we thought we'd kind of get the process going.
But when Mitrail's water is broken, her doctor discovers a big problem.
There is.
Oh, there is.
Yeah, okay, we'll need RT. Okay. You might not be able to cut the cord, but baby pooped inside.
What are we dilated?
Almost complete. There's just an anterior.
Okay, I'm going to have RT come and be present and get ready.
Meconium is fetal stool. The baby had a bowel movement in utero, which can be extremely dangerous.
The thicker it is in the amniotic fluid, the more threat it poses to the baby's health if they happen to aspirate it, because it's pretty irritating to the lungs, as you might imagine, and it could potentially cause pneumonitis and a pneumonia, difficulty breathing for the baby.
Yeah, what we're going to do, hon.
Now, Mitrail's delivery plan has changed considerably.
Okay, it's going to be a little bit different for
Because of the baby pooping inside, we're gonna need to suction on the perineum. So as soon as the baby's head comes out, we need to suction. So Dr. Hiramata will say, don't push, just try to listen, okay? And she's gonna suction the mouth out and try to get all the poop out of there, okay? So the baby doesn't go and take it in, okay? So just really listen to what she's telling you. I know you'll do great. You'll do fine. Everything will be fine, okay? This is just the best for the baby. And the baby will probably come out and scream and yell, okay?
We've had her now on the Pitocin for a good hour. She's been in a good pattern, and we'll see if she's changing her cervix.
Myrna Saravia's labor hasn't progressed much in the past 4 hours, and her doctor is concerned.
Well, you know what? You're still about the same.
The Pitocin that she's been on since late last night gets her contracting, but her baby's heart rate doesn't stabilize after each contraction.
I would continue the Pitocin on her, and she would just continue to do this. She might eventually change her cervix, but right now she's just not. She might also have the trouble with the baby's heart rate again. It could happen again. Stronger pattern.
She is still only 4 centimeters dilated.
You're contracting every couple minutes, but you're just not changing your cervix. I think we should probably just go ahead with a C-section. Okay. You're tired too. I know you want to do that, don't you?
I want to see him.
You're ready, aren't you?
Yeah.
Okay. Well, the worst case scenario, obviously, that we would get into if we didn't do a C-section is if she kept contracting, the baby had some more problems, heart rate went down and just didn't come up, and basically then the baby would be suffering, and we'd have some very bad consequences with that. Okay, so that epidural's working, huh? Yeah.
Moments ago, doctors told Myrna Saravia that she would need a C-section.
She hasn't changed her cervix. It's been about an hour, well, more than an hour, with a regular contraction pattern on the Pitocin. She just doesn't seem to be moving along.
With each contraction, Myrna's baby was suffering.
You can risk losing the baby if the baby isn't able to tolerate those and come back after a while. There's so many times that it can do that, and then it might not come back.
This is the only alternative for Myrna and her baby.
She's ready. She wants to see her baby, she says, so we'll have it out shortly. Bladder blade, please. A lot of pressure.
Although the epidural rendered Myrna completely numb, she is still extremely uncomfortable.
The epidural seemed to be working because she didn't feel anything that we were doing. Sometimes they associate a pressure with a little bit of pain.
A normal C-section can last as long as 10 minutes from first incision to delivery. But once inside the uterine cavity, doctors are having trouble getting the baby out.
Just from the position it was in, it was easier to just put a vacuum on the baby's head and actually pull it out with a vacuum because it just kept falling down and wouldn't come down out of the incision.
In the green.
Finally, the baby makes it out of the womb, but something's wrong.
Baby was also a little bit floppy, okay, not really as vigorous as we like to see them. Just rub the baby. Just rub the baby. Teresa, clamp. Hurry, Teresa, take the baby. Here.
The difficult labor has caused this baby to have a difficult birth. He's having a hard time breathing on his own.
It could be from the decelerations. Definitely this baby had some problems with the contractions, just kind of get tired.
The medical team tries to get the baby to cry. Only then will he open up his lungs.
Needs a little oxygen.
Finally, with that tiny cry, everyone breathes a sigh of relief.
Moist lap, please, bladder blade.
Well, I can tell you right now.
But he needs to cry and react more.
Babies are really, really resilient. They can come back quickly. They just need some stimulation, sometimes a little bit more. It took a little while for him to start breathing, but he really perked up and did really well after that.
The more he cries, the more he exercises and inflates his brand new lungs.
The baby is young, Andres.
Juan Andreas Mendez weighs 6 pounds, 14 ounces, and his parents couldn't be more proud.
This is my baby. This is their first baby.
Since arriving for induction 8 hours ago, Millicent Rodriguez has been feeling like a human pincushion.
Just a drop. There you go. This gives us our best way.
Because of her severe gestational diabetes, doctors are especially concerned about her blood sugar.
Beautiful. Thank you. All of your watching that dumb diet has paid off. Millicent has been very careful about controlling her diabetes, so she's making my job easier. All of her sugars have been normal, but I'm going to check them every 2 hours just to make sure. The baby is so used to getting lots of sugar, especially from an uncontrolled diabetic mom, that they're in danger of getting the shakes from no sugar afterwards when the gravy train is cut off.
It's been a challenge. It's been hard for her and for us because she has to manage her sugar and make sure everything's normal, and I have to help her with it. And it gets hard sometimes.
You move over to your back. Check and see what your cervix is doing.
Babies with gestational diabetes are in more danger than their moms.
Because they're on this high-calorie diet, they're getting high sugar coming through from mom through the placenta, and so the babies bulk up, and you get these beautiful, bulky babies, and they look like little Pillsbury Doughboys, big, sweet diabetic babies, but they're still immature.
And big babies have a hard time being delivered.
There are specific ways to get the baby out, but we're trying to get the baby out as smoothly and gently and as quickly as possible. You only have so many minutes before pressure to cord is cutting off oxygen to the brain. So it's a tight moment there. You're thinned out to about 80%.
Millicent Rodriguez has been diligent about keeping her blood sugar in check, but that doesn't mean her baby or her delivery will be normal.
Okay, I'm going to put this on you in case I need to put the baby on you, okay?
Moments ago, doctors broke Mitrail's water only to discover her amniotic fluid thick with meconium, or fetal stool.
You're going to feel a lot of pressure down here, okay? Unfortunately, when babies have meconium in the amniotic fluid, we need to get them over to the respiratory therapist as quickly as possible.
Within an hour, Mitrail dilated from 5 centimeters to 9, and now she's ready.
If you're not contracting, try to relax.
Okay, got it again? You want to grab your legs?
3,
Okay.
4, 5, 6, 7, 8.
Good job.
9.
Good. Good job.
Push!
Ah, come on, push. You see hair? Baby's got hair like daddy, huh? Good, you've got it. Keep going.
Oh.
Gilbert?
Yeah.
When you're ready, they need you in OR.
Okay, just, I'm trying
He'll
to
be
get
there as soon as he can.
Mitrail is delivering without an epidural, which makes it especially hard for her to stop pushing once the baby's head is out. Only then can the doctors clear its lungs before any fecal matter gets in.
Now blow.
Okay, now this is the real important. This is
very important.
Don't push. You're doing great. Good control. You are awesome.
Michelle, could you get the baby's heart rate on here?
Good. Okay, now there you go. Look down. There's your baby. It's a boy!
Told you.
Once the baby is out, the respiratory therapist takes over.
Ready?
Suctioning out the meconium, which is basically baby poop, out of his lungs, make sure he doesn't breathe any more than he already has. Worst case scenario, the baby could die from something like that if it's not treated properly.
Emron Ahmad Carter is out of danger. His lungs are healthy, and so is his weight. Very healthy indeed. A great big bundle of joy, a supersized special delivery. Little David Rodriguez was born 5 weeks early.
There haven't been any breathing issues for me. He had a little bit of what we call nasal flaring, just means they flare their nose out to try to get a deeper breath in.
His blood work also came back normal. Today, he's moving from the newborn nursery into his mom's room, where she'll finally be able to take a good long look at him.
I was real worried at first. I'm glad everything came out fine though.
But there's a problem. Because he's a preemie, David is having trouble eating. And if his parents can't get him to eat, he can't leave the hospital.
He's 2 days old, and we're getting ready to go home.
48 hours after being delivered by emergency C-section, Jonathan Sheena is going home. His mother, who suffered from pregnancy-induced hypertension, with blood pressure reaching as high as 148/87, is doing just fine.
It's like in the 118s to 130s it ranges, and they said I'm doing a lot better.
Now that she's out of danger, Nicole is enjoying the simple pleasures of motherhood.
I'm looking forward to seeing him talk and just see the way he's gonna be, his personality, and how he's gonna act, and what kind of person he's gonna come out to be. I know I'll have more. Probably 2 more, maybe 1 more. I'm not sure yet.
Page Dr. Woods for delivery, we're complete.
In just 30 minutes, Millisent went from 7 to 10 centimeters.
Completely dilated.
She's finally ready to have her baby.
Hello. You ready? She went really quickly right after the epidural. The main concern right now is making sure that we proceed with a vaginal delivery. I still have some question on the size of the baby, even though I think we're an okay size. But there's a higher risk that these babies, even though they may be the right size, will, because of mom's diabetes, develop more fat around their shoulders and abdomen and have a higher risk that they'll require C-sections. Put your hand behind your knees here, both sides, if you can behind. There you go. Curl up in a little bit of a ball and push down here in your bottom. That's it, that's it. That was a wonderful push. Okay, 1 more and do it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, take a deep breath and do it really quick. Hard, 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 hard. Curl up in that ball. Pull your legs back, pull your legs back, pull your legs back. Good, 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 good. That's hair. That was good. That's it. Whatever you're doing great. Take a deep breath and then do it again. Oh,
she was facing that way.
Yeah, there we are. There she is. You got your legs down, right?
Finally, after almost 10 hours of labor, Mackenzie Lane Rodriguez makes her debut.
Finally over. It's the beginning.
She looked great. She came out screaming. So she did very well, and she was just the right size.
7 pounds, 11 and a half.
Mackenzie, I want you to meet your daddy.
Miguel, here's your daughter.
Thank you.
I love that sacred moment when I hand the baby to the dad and say, this is your son, this is your daughter. There's nothing like it. Dad, when he held the baby, his voice broke and he was crying. Little Mackenzie turned her ears to hear her daddy's voice, and that just grabbed him by the heartstrings.
I don't think there's any words in the world that can come up with a word so powerful. It's a joy unbelievable.
It's as close as we get to seeing the miracle of creation all over again. Not just to see the baby come, but to see the light go on in a parent's eyes.
The delivery may have indeed been a miracle, but Millisent needs one more. She needs Mackenzie to pass her blood sugar test.
Okay, you will be eating right right now, hold on. Don't cry, baby.
Juan Andres Mendez is less than 48 hours old, and he's already taken his mother's breath away.
I see him and I cannot believe it. It's my son. The reason I'm putting yellow is because my mom said it's a tradition. It says that it gives him luck or something like that. I'm not sure.
Juan Andres is already lucky.
He looks like a little chimichanga.
He's a special delivery, on his way to begin his own special life.
You guys have fun with him. Okay. Bye-bye.
He's doing okay. He's having trouble nursing on his own, but we're working on that.
David Rodriguez is on a very strict feeding program.
They want him to eat an ounce of every 3 hours.
But he's not doing too well.
He's just having a little bit of trouble with the sucking and swallowing coordination.
Under the watchful eye of the nursing staff, Raquel and her boyfriend, DJ, coax the baby to eat. If he doesn't, he can't leave the hospital.
And if he eats, then he can go home.
If he doesn't eat, then he can lose weight. And if he goes home and he's not eating, then he might end up at Valley Children's with IVs and things. So he needs to be eating properly before he goes home so the parents don't have to worry about that.
If Raquel and DJ can get baby David to finish the whole ounce in 30 minutes, they can take their baby boy home.
Come on, you got any more for me?
He ate the amount, but it was 35 minutes with Dad doing a lot of the work. And this is not what we want with preemie babies.
Raquel and DJ can't take David home today.
I wish I could take him home with us and stuff, but if that's what's best for him is to stay and nurse properly, then I want the best for him.
I'm going to double check the baby's blood sugar. She's an hour old now, so it's time to check that sugar and make sure she's safe.
Millisent Rodriguez is about to find out if all her hard work maintaining her blood sugar has paid off.
Hers needs to be over 50. I'm not worried about high blood sugar, I'm worried about it being too low. So I need it to be 50 or over. Yay, 52! 52 is great. You got an A on your first test. We'll check it again in another hour, and then 2 hours after that, and then before every feeding for the first 24 hours. So you guys call us before you feed her. Or if you see that she's pale, she's jittery, she's having any trouble.
Since Millicent kept her blood sugar low, Mackenzie didn't have to produce extra insulin, making this delivery especially sweet. A sentiment shared by all the mothers who endured the pain and suffering, the joy and sorrow, the endless emotional roller coaster ride of high-risk pregnancies, just so they too could welcome a special delivery into their lives.